All right, so thanks so much again for doing this. My first question to you is tell the audience a little bit about yourself and how you started in the community.
Yeah, so a little bit about me. My name is Emily. I use she, her, pronouns, and I first started my work since I want to say like 2018. I'm from Yakima, Washington, mainly agriculture farm working community, and I think it's important to talk about my background because that set the catalyst for the projects that I say yes to, the programs that I'm in, and the community partners that I'm with, including my practicum at the Latino Center for Health, which is where I currently work, having graduated with my master's. I've been with the community, I want to say for years now, since starting my bachelor's and then continuing on to graduate level studies. I've always been passionate about giving back to the community. And then when I found the Latino Center for Health back in 2022, they really set me up for success and let me partner with some of their organizations. So I've been working with the community for a couple of years now, and I found the University of Washington Latino Center for Health in 2022 when I started doing my practicum for them for my master's in social work.
Mm-hmm. So t tell the audience like a little bit about the work that you do. What's that about? What's the day-to-day like?
Yeah, the day-to-day definitely varies. It depends on really the community's needs. I feel like talking a little bit about the center, so the Latino Center for Health, been there for almost 3 years now. We do research that influences and that impacts policy. So we're not policymakers, but we do different research projects that attempt to address the health disparities and health inequities among the Latinx community. And so what I do, what I'm involved in, it really just depends on what the center what the center is responding to the community's needs. And so something that we noticed that data showed was something that I'm really passionate and worked on was mental health. And that included research regarding Latina suicide ideation and completion among adolescents in Washington State. And that was the focus of my research for about a year. And so that's something that I worked on, that I partnered with the Washington State Department of Health, with folks from the Healthy Youth Survey that gave me access to their data. And so that's the work that I've been working on, as well as assisting with the center's various projects, such as cognitive behavioral therapy. And then our most recent one that I'm currently working on is raising awareness regarding domestic violence and traumatic brain injury among the Latino community. And that's something that I'm also really, really passionate about to be engaged with.
Mm-hmm. To follow up on that point, what has the data shown in terms of like the rates among Latinos and mental health and like you also did something about domestic violence and all that kind of stuff?
Mm-hmm. Yeah, I can talk a little bit more about mental health and the impact that that has on the Latino community. So research from the Center for Disease Control and Prevention, or the CDC, showed that suicide was the second leading cause of death nationwide among ages 10 through 14. And that is really young. We're talking about folks that are like in sixth and eighth grade. And in case folks, listeners aren't familiar with it, the Healthy Youth Survey, it's a survey that is administered every 2 years statewide from 6th to 12th graders in Washington State. And that survey asks a bunch of questions ranging from adolescent health and well-being to like risk behaviors, substance abuse, feelings of loneliness, hopelessness, anxiousness, and thoughts of suicide. And so something that was really alarming was that in 2023, it showed that sixth graders in Washington, and mind you, these are 11 to 12-year-olds, 20% have contemplated suicide. While trends are decreasing since then, they are nowhere near the same compared to 2010 to 2016. That was lower than 16%. And then in 2023 as well, eighth graders in Washington, and that's about 13 to 14 years old, it was about 15.2% that have contemplated suicide. And I also realized that I throw around these terms because there's a huge difference between suicide, which is death caused by self-directed injurious behavior with an intent to die as a result of that behavior, versus a suicide attempt and suicide ideation and consideration. Like the language is very different. And I wanted to be conscious of that, of listeners, and also provide a content warning. I apologize, I didn't say that sooner, but when talking about this, it's important to know that we're looking at suicide, like deaths by suicide, and then folks that consider, ponder, and plan a suicide attempts, and then those differentiate a lot. And something that was also very alarming and that caught attention was that 1 in 5 Hispanic girls attempt suicide nationwide. And that's something that we need to keep in mind, is that suicide does not affect all communities equally or in the same way. And my push was for prevention strategies and intervention programs that focus on the community's needs and that embed protective factors and the local culture of the community. When thinking about suicide prevention, it's not a one size fits all model. And I think we need to be very cautious of that when working with different bicultural groups when talking about mental health access.
Mm-hmm. My next question is, I know that you talked a little bit about this, but like what methods or approaches do you use for this particular type of work? Because you're heavily involved in research and all that kind of stuff. So if you could talk a little bit about that.
Yeah, the methods that I mainly used were we completed a secondary, I think it's called a secondary literature review. And it's basically where I was able to collect, I have maybe like 50 different articles that I was able to synthesize regarding my research topic, ranging from different parts of like in the US, ranging from Washington to other rural like states, other like counties. It was a lot of literature review, a lot of just analyzing like the literature, and then also having access to quantitative data. So that was where like folks from like the Healthy Youth Survey from the Department of Health came in, and also I believe I also had data from the Washington State Department of Health, their Injury and Violence Prevention Department, and their Division for Disease Control and Health Statistics. So that was really helpful to request permission to access their data. That way we could see the suicide counts, specifically in Washington State. And also the Department of Health has really good reports that identify suicide rate counts in Washington by race and ethnicity. And so those are some of the data that I use. So some of the methods was being able to access to literature and then access to data from that the state was reporting on already through surveys like the Healthy Youth Survey, was things that I looked at and use in my presentations and when I do present speeches. So.
Mm-hmm. My next question is, what impact does that your type of work have on the greater community? In other words, how does doing this research, how kind of really shed a light or raise an awareness among, like mental health within the Latinx community? Because you talked a lot about that in detail. So,
Mhm. Yeah, and I hope that my and me like presenting, because I was very fortunate and grateful to share this with multiple different audiences. And for that, I think it's important that we not only work at the structural level, but at the individual level. And so I was able to do kind of similar like this, like a radio interview with Radio Cadena. And so I was able to translate some of my information from English to Spanish. And so that was also really, really helpful because I feel like I talk about the Latino community, but I need to make it in a way that's accessible, and that's kind of changing that norm or like that stigma around the Latino community when it comes to accessing mental health services. And so for me, being able to distill my research and talk about it in the lay terms, in terms that's easy to understand, that's able to digest for folks that can listen to it and then do something about it. I thought that was really humbling as well. So something that has come about when doing these interviews and doing presentations is I try to advocate for improving access to care, and that involves things like primary prevention, early screening, and early identification. Research has also shown that telehealth models can be improved specifically for different communities. And so when talking about the Latino community, we want to really reinforce that patient-centered care, which focuses on the patient's needs and is accessible, is equitable, and respectful. So for example, the Latino community, we use WhatsApp a lot. And so using platforms that we're already comfortable and familiar with, that could also be incorporated into telehealth models that, of course, follow HIPAA compliance. We also have evidence that suggests that school-based programs that include mental health promotion and suicide prevention for young people can prevent suicide ideation and suicide attempts. And so that's something that I was also pushing for is, a lot of these youth and adolescents spend time, majority of their time in schools. And so having school-based programs that talk about mental health and access to care and being able to identify those feelings and having peer support is really huge, and that's shown to be a buffer and a protective factor in our community as well. And so even just engaging in that talk, and I bring this back to the Latino community because of often how stigmatized it is to talk about your feelings or about mental health. That's something that folks, when listening on the radio or when I gave my presentation at I think it was the Washington Behavioral Health Conference this year, was something that I wanted to emphasize was that everyone has a role in suicide prevention, acknowledging the seriousness of the adolescent's pain, and that silence and stigma about suicide do create more harm. And so we need to be able to initiate conversations and be direct. So I was able to give talking points on how to engage in Spanish, it's la plática, in English, how to engage in the talk. So using those open-ended questions, being able to identify, how long have they been thinking or considering suicide? How might you carry this out? And this gives the person time to assess the situation. How much time do I have to intervene? And so something that I always bring up to my audience is that research shows that a majority of adolescents will most likely tell a peer than a trusted adult or parent. I believe it's 3 in 4 Latina youth will confide in like a close friend, versus 1 in 4 will only tell an adult. And so I think that's something that I wanted to be aware of and wanted to say to folks, because I don't know if like other adolescents were listening in. And so I wanted to let them know that everyone has a role in suicide prevention, big or small, at the organizational level, interpersonal, or at the system level. So I don't know if that answered the question. I feel like I kind of derailed.
No, no, that's a good answer. To kind of wrap this up, what can people sort of take away from this conversation? How can, the greater public be sort of educated about mental health, but like particularly among certain demographics, certain groups, because a lot of people like just don't know or aren't aware of it. So like what would be your sort of take on that?
Hmm. I think just being open to having these conversations about mental health, as I mentioned before, ignoring them and pushing this conversation to the side, it perpetuates that and it does more harm than good. And so I think when even talking about just like youth in general, being able to empathize with them and understanding that youth are at a very vulnerable time and they're growing in adolescent phase. And when you throw in bicultural, BIPOC communities such as like Latinas or Latino immigrants, like you're having these different intersecting identities, having to discover your identity and figure out who you are while simultaneously navigating life, like school, work, family obligations, being in your community, like that's intense and that's a lot. I have this quote that I use in my presentations in Spanish. It's ni de aquí ni de allá. In English, it's not here nor there. And so when talking about like specifically, I focus on the Latino community. So when talking about the Latino community, you get things like you're not Mexican enough, your Spanish is not good, or you're not American enough, your accent is coming through. And so I think just focusing to be more cautious and more empathetic and just more graceful and patient when talking with these communities and when working with these communities as well. As it's not all bad. I think we also need to focus on the protective factors. While there are multiple risk factors that impact this community and that impact others differently, I think it's important for researchers and community health workers, public health practitioners, folks that are involved in policy making and program making, to look at what's already working in the community, to meet the community halfway, and to focus on their protective factors because there are things that are working. So when talking about the Latino community, some things that have shown to create that buffer and to help is that ethnic affiliation, is that cultural acculturation, religion, and spirituality, their faith. Connecting, with caregivers and being able to problem solve in families that are open to talking about mental health in the Latino community, that has shown to be a positive effect among Latina adolescents. So I think something to the audience can take away is when trying to look at interventions or when trying to look at suicide prevention is to not apply a one size fits all model. Each community is beautiful and unique and they're different and they have their own set of factors that we should be looking into when working with them, when creating interventions for them.
All right.